Each course in the Lean Healthcare series is designed as a workshop rather than a lecture. Your staff will not just read the material, they will learn it. Our online, interactive, and engaging method of training is for everyone. The initial movie is a true story and is supplied to set the stage and provide an example of the current healthcare situation and the need for change. The balance of this course is divided into 4 modules, plus a criterion reference test.
The following is based on a true story. On Wednesday, July 22nd at 4 p.m., Mary was biking home from university when she hit a deep hole trying to pass pedestrians and flew over her handlebars, resulting in a terrible accident. Mary waited in emergency for 1 hour to get a bed, and then another 6 hours to see a doctor. A CT scan revealed her jaw was broken in 2 places, 3 of her teeth were lost, and several severely displaced, and her right arm was broken. Mary was discharged from emergency at 1:30 in the morning on Thursday with only a diagnosis. Why didn't she receive care? Mary needed to see an orthopedic surgeon, a plastic surgeon, and an orthodontic surgeon. On Saturday, 4 days after the accident, Mary was admitted to hospital to have her arm operated on. But she was directed to the wrong floor. This made her late for her scheduled surgery, and the surgeon moved on to another appointment. 1 hour after her surgery, Mary was asked to leave her hospital bed to make room for another emergency. Mary contacted her surgeon for a consult. However, he was not available, so she made an appointment with her family doctor to answer her questions. To mend Mary, it took 11 surgeons to consult and/or operate, 8 visits to the hospital, 4 days of waiting, 3 bouts of anesthetic, 2 visits to the family doctor. Mary is on the road to recovery. By providing her story, she hopes to accelerate improvements in healthcare. This course introduces the concepts of lean, a philosophy and set of strategies and tools that have proven to be very effective in bringing about positive changes in the practice of healthcare. Once you understand the philosophy and the approach, you will be ready to proceed on your lean journey.
Each module begins with a description of the content to be covered.
This module describes the advantages enjoyed by organizations that choose to focus on applying lean principles to their procedures and processes. Topics include understanding value from the perspective of the patient or client.
This course is carefully designed to foster learning that changes behavior. To learn rapidly and to retain new concepts, the learner must be engaged. There are myriad ways to promote mental participation, such as asking questions that focus thoughts onto a specific concept.
If you are buying a product or service for yourself, what is the first thing you look for? Click on an appropriate answer. Price, on-time delivery, quality, service. That is difficult to answer without a specific product or service in mind. You look for value. Whether you are buying a $40,000 car or a week's supply of vegetables, the price, availability, quality, and service all have a place in your decision-making. Our patients and clients use the same kind of decision-making as you do. Patients and clients expect the best possible balance of price, availability, quality, and service. They expect top value.
Recognition that the learner already understands some portions of the concept serves as a mental hook into the learning experience and thus expands on existing knowledge, as evidenced by this simple example. Often, learners have strongly held beliefs about what can or cannot be accomplished, or what is or is not true. Mythbuster sequences, such as the following case study, can help to dispel these notions.
In a major hospital emergency department, there was a large variation in how different team members conducted their assessment, testing, care, and treatment. Impacts included unacceptable patient wait times for initial assessment, unnecessary patient stress and dissatisfaction, unnecessary staff stress and frustration. The team believed that they had a unique set of problems and that there was just too much variation in their work to apply any standard methods or lean concepts to help them. Do you think they are unique? Yes or no? Well, they certainly will have a large variation in the demands put on them, but this hardly makes them unique. Many teams in many environments are faced with high variability. But once the team became engaged, they carried out a major Kaizen, change event. Their goal was development of standard practices to reduce patient wait time and to provide optimum care. The result? A 25 to 40% reduction in patient wait time. With benefits of this magnitude, why isn't every organization lean? A part of the problem stems from the belief that situations are unique and intractable. Everyone has to be convinced to get on side.
This course also uses case studies to introduce new concepts or to provide concrete examples.
To respond to a pandemic warning, one clinic mixed a large batch of flu vaccine in anticipation of client demand. When clients did not show up, much of the limited shelf life batch was discarded. What could cause the total system to not operate at a balanced pace? Click on All That Apply, then click Done. Good. The first processing step was working faster than the second one required. Yes, time can be a factor. Good. When more vaccine is produced than the next step requires, the result is waste of overproduction.
Of course, we also precisely define new concepts.
When an end-to-end process stops flowing and a person, staff worker, or the work itself, the patient, has to wait, we have the waste of waiting. Do you recall Mary's journey through the surgical stream? On the day of her accident, even though she had suffered serious injury, she was kept waiting for 6 hours before she could see a doctor.
Note also the use of the recurrent example to stitch together the learning experience. Because background knowledge and learning speed differ from individual to individual, it is important to give control to the learner. The learner can choose to listen to the audio track and read along on a screen, or to devote time to analyzing graphical information. The audio provides another modality, but is not essential for the learning. We generally provide individualized responses to alternate answers.
In lean organizations, where do most of the ideas for improving process come from? Well, managers are able to bring knowledge and experience and should be part of the team. Who else?
When you choose the best response, then the program advances. So the more wrong answers you choose, the more detail you receive. Some learners deliberately choose incorrect answers first, just for the feedback. But if you know the topic very well, are particularly tight for time, or are reviewing a section, you might choose to advance through it quickly.
Right.
Note that the learner must answer questions the first time through the course, and can always backspace and review, but cannot proceed until a question is answered. On subsequent times through the material, the learner can arrow rapidly or linger over any screen. From the main menu, the learner can revisit any module, returning automatically to the last page viewed in that module. This course recognizes that healthcare is a complex system that requires engaged decision-making. It encourages learners to consider how they can introduce and follow lean practices, and then helps them understand the importance of full engagement in the lean process to identify when myths are used as excuses.
The fundamental issue is that we have to think out of the box and neither accept bad situations as inevitable nor jump to conclusions about the best way to solve problems without proper analysis. For some, conventional wisdom says, if it were all just computerized.
This course demonstrates some practices that clearly lead to rapid, sustainable improvements.
In a lab environment, machines should be grouped in such a way that facilitates flow and reduces unnecessary operator movement. These before and after photos of a lab in East Kootenay Regional Hospital Laboratory show the results of a concerted lean drive.
Of course, the objective of training is not just to show, but to have people learn. We test that learning has occurred with a carefully designed criterion reference test that includes questions related to each objective in the course. Learners can choose to take a pretest or challenge the test, to complete the test after completing each module, or to test on all modules after they've completed all coursework. They can also revisit any modules to improve their score. In the final test, it is not possible to advance to a new question without ultimately choosing the correct answer. You might ask why, since this approach would make the scores artificially high. Our prime focus is on reinforcing positive learning and thus changing behavior. Learners will not achieve a passing mark if they do not know the material. This approach to testing supports overall learning. In summary, the unique benefits of this approach include: the courses are specifically designed for the needs of all staff throughout the organization. The content is standardized, ensuring consistency across all organizational levels. Courses are easy to access and use regardless of the level of computer experience. Concepts are explained with graphics, photos, and video clips for improved understanding across learning styles. Modules are easy to stop and start, and therefore support flexible, on-demand scheduling. Individuals set their own pace, resulting in increased content retention and behavioral change. Repeatable sections and modules enhance individual learning. Clear, accurate content is provided in common language instead of confusing business or academic jargon. Administration access to participant lists, progress charts, and scores lead to more effective control of learning outcomes.